The best medicine for diabetes. Diabetes, symptoms, causes, treatment. This video you will discover what is diabetes, what are the symptoms, the causes, and what are the best natural treatment. These tips will serve you all your life. So, please stay to the end of this video. It worth it. Diabetes mellitus is a nutritional disorder characterized by an abnormally elevated level of blood glucose and by the excretion of the excess glucose in the urine. It results from an absolute or relative lack of insulin, which leads to abnormalities in carbohydrate metabolism as well as in the metabolism of protein and fat. Diabetes is a disease known to the medical world since time immemorial. Its incidence is, however, much higher at present than ever in the past. This is especially true in the case of more advanced countries of the world due to widespread affluence and more generous food supply. The most commonly used screening tests are the determination of the fasting blood glucose level and the 2-hour postprandial, which is after a meal. The normal fasting blood sugar content is 80 to 120 milligrams per 100 milliliters of blood, and this can go up to a level of 180 milligrams per 100 milliliters of blood 2 hours after meals. Anything above these norms can be termed diabetic levels. Diabetes occurs in all age groups, from young infants to the elderly. The greatest incidence occurs in middle or older aged persons. It is estimated that 80 to 85% of all individuals with diabetes mellitus are 45 years of age or older. Symptoms. The word diabetes is derived from the Greek word meaning to siphon, to pass through, and mellitus comes from the Latin word honey. Thus, two characteristic symptoms, namely, copious urination and glucose in the urine, give the name to the disease. The normal volume of urine passed daily is about 1.5 liters. The urine is of a pale color, has an acidic reaction and sweetish odor. The quantity of sugar present in it varies from 1¼ decigram to 2½ grams the total per day, in many cases reaching as much as 1 kilogram in 15 liters of urine. A diabetic feels hungry and thirsty most of the time, does not put on weight, though he eats every now and then, and gets tired easily, both physically and mentally. He looks pale, may suffer from anemia, constipation, intense itching around the genital organs, palpitations, and general weakness. He feels drowsy and has a lower sex urge than a normal person. Causes. Diabetes has been described by most biological doctors as a prosperity disease, primarily caused by systematic overeating and consequent obesity. Not only the overeating of sugar and refined carbohydrate but also of proteins and fats, which are transformed into sugar if taken in excess, is harmful and may result in diabetes. Too much food taxes the pancreas and eventually paralyzes its normal activity. It has been estimated that the incidence of diabetes is 4 times higher in persons of moderate obesity and 30 times higher in persons of severe obesity. Grief, worry, and anxiety also have a deep influence on metabolism and may cause sugar to appear in the urine. The disease may be associated with some other grave organic disorders like cancer, tuberculosis, and cerebral disease. Heredity is also a major factor in the development of the disease. It has been rightly saying, heredity is like a cannon and obesity pulls the trigger. Treatment. Any successful method of diabetes treatment should aim at the removal of the actual cause of the disease and building up of the whole health level of the patient. Diet plays a vital role in such treatment. The primary dietary consideration for a diabetic patient is that he should be a strict lacto-vegetarian and take a low-calorie, low-fat, alkaline diet of high-quality natural foods. Fruits, nuts and vegetables, wholemeal bread and dairy products form a good diet for the diabetic. These foods are best eaten in as dry a condition as possible to ensure thorough salivation during the first part of the process of digestion. Cooked starchy foods should be avoided, as in the process of cooking the cellulose envelopes of the starch granules burst and consequently, the starch is far too easily absorbed in the system. The excess absorbed has to be got rid of by the kidneys and appears as sugar in the urine. With raw starchy foods, however, the saliva and digestive juices in the small intestine regulate the quantities required to be changed into sugar for the body's needs. The unused and undigested portion of raw starchy foods does not become injurious to the system, as it does not readily ferment. The diabetic should not be afraid to eat fresh fruits and vegetables which contain sugar and starch. Fresh fruits contain sugar fructose, which does not need insulin for its metabolism and is well tolerated by diabetics. Fats and oils should be taken sparingly, for they are apt to lower the tolerance for proteins and starches. Emphasis should be on raw foods as they stimulate and increase insulin production. For protein, homemade cottage cheese, various forms of soured milk, and nuts are best. The patient should avoid overeating and take 4 or 5 small meals a day rather than 3 large ones. The following diet should serve as a guideline. Upon arising, a glass of lukewarm water with freshly squeezed lemon juice. Breakfast, any fresh fruit with the exception of bananas, soaked prunes, a small quantity of wholemeal bread with butter and fresh milk. Lunch, steamed or lightly cooked green vegetables such as cauliflower, cabbage, tomatoes, spinach, turnip, asparagus and mushrooms, 2 or 3 whole wheat chapatis according to appetite and a glass of buttermilk or curd. Mid-afternoon, a glass of fresh fruit or vegetable juice. Dinner, a large bowl of salad made up of all the raw vegetables in season. The salad may be followed by a hot course, if desired, and fresh homemade cottage cheese. Bedtime snack, a glass of fresh milk. Flesh foods find no place in this regimen, for they increase the toxemic condition underlying the diabetic state and reduce sugar tolerance. On the other hand, a non-stimulating vegetarian diet, especially one made up of raw foods, promotes and increases sugar tolerance. Celery, cucumbers, string beans, onion, and garlic are especially beneficial. String bean pod tea is an excellent natural substitute for insulin and highly beneficial in diabetes. The skin of the pods of green beans is extremely rich in silica and certain hormone substances which are closely related to insulin. 1 cup of string bean tea is equal to 1 unit of insulin. Cucumbers contain a hormone needed by the cells of the pancreas for producing insulin. Onion and garlic have proved beneficial in reducing blood sugar in diabetes. Recent scientific investigations have established that bitter gourd chlorella is highly beneficial in the treatment of diabetes. It contains an insulin-like principle, known as plant insulin, which has been found effective in lowering the blood and urine sugar levels. It should, therefore, be included liberally in the diet of the diabetic. For better results, the diabetic should take the juice of about 4 or 5 fruits every morning on an empty stomach. The seeds of bitter gourd can be added to food in a powdered form. Diabetics can also use bitter gourd in the form of decoction by boiling the pieces in water or in the form of dry powder. Another effective home remedy is a jamble fruit known as jamun in the vernacular. It is regarded in traditional medicine as a specific against diabetes because of its effect on the pancreas. The fruits as such, the seeds and fruit juice are all useful in the treatment of this disease. The seeds contain a glucoside jambalana which is believed to have the power to check the pathological conversion of starch into sugar in cases of increased production of glucose. They should be dried and powdered. This powder should be taken mixed in milk, curd, or water. The patient should avoid tea, coffee, and cocoa because of their adverse influence on the digestive tract. Other foods that should be avoided are white bread, white flour products, sugar-tinned fruits, sweets, chocolates, pastries, pies, puddings, refined cereals, and alcoholic drinks. The most important nutrient in the treatment of diabetes is manganese, which is vital in the production of natural insulin. It is found in citrus fruits, in the outer covering of nuts, grains, and in the green leaves of edible plants. Other nutrients of special value are zinc, B-complex vitamins, and polyunsaturated fatty acids. Exercise is also an important factor in the treatment of diabetes. Light games, jogging, and swimming are recommended. Yoga, hydrotherapy and colonic irrigations form a very important part of treatment. The colon should be thoroughly cleansed every second day or so until the bowel discharge assumes normal characteristics. Bathing in cold water greatly increases the circulation and enhances the capacity of the muscles to utilize sugar. The diabetic patient should eliminate minor worries from his daily life. He must endeavor to be more easygoing and should not get unduly worked up by the stress and strain of life. Thanks for watching. If you liked this video, please hit the subscribe button to receive more like it in the future. If you liked this video, share the love and give it a thumbs up.